In my opinion, the ForeseeHome is the future of the management of macular degeneration. Early detection is the key. It's kind of like treating cancer. We haven't really made that much progress in chemotherapy. We're saving lives in cancer therapy because of early detection. Similarly, for age-related macular degeneration, we're going to be saving vision because of early detection. And so the paradigm is going to be identifying who's at high risk, typically with genetic testing, and then placing those individuals on a ForeseeHome device for early detection. Early detection of AMD is critical because it's well documented in multiple large randomized clinical trials that the earlier we catch CNV and treat it, the better the visual outcome will be. Well, early detection of the CNV allows me to treat it at an earlier time point. So I'm seeing patients when their vision is maybe 20/25 or even 20/40, and if I give them treatment, I have a very good chance of getting them back to 20/20. If I have late detection of CNV and I treat it, then I'm taking a 2200 eye or even a 2400 eye, and we're lucky if we get them to even 20/80 or 20/60. The ForeseeHome device has the ability to detect distortion before the patient notices it in their own daily life, and sometimes even before the OCT or fluorescein angiogram show. So occasionally when they come in for their first visit, I see nothing on clinical examination, OCT or fluorescein, but I have them come back in 2 or 3 weeks because it can show up at that time. And at that time, we've still caught it extremely early. The early onset of macular degeneration looks different on OCT and fluorescein angiography when the ForeseeHome device detects it, rather than waiting for it to progress to the stage where it's clinically obvious to both me and the patient. So in my practice, I use the ForeseeHome device for people at high risk for developing wet macular degeneration. And they're still going to see me on a regular basis, but these patients have the comfort of knowing they're being monitored even when they're not seeing me in the office. So the Amsler grid has been used for decades as an early home detection system for looking at distortion, the first sign of wet AMD. The Amsler grid is good, but it's not great. And one of the main problems with the Amsler grid is compliance. So I'll ask my patients who are at high risk for developing wet macular degeneration how often they check their Amsler grid, and we're lucky if it's once a week. Sometimes it's once every few weeks. So a big advantage to the ForeseeHome device is that it's being monitored. There's a compliance factor. If you're not using your ForeseeHome device, someone's going to call you and say, use it every day. So when I introduce this concept of home monitoring with the ForeseeHome device to my patients, they're a little skeptical at first. And when I describe that it's like looking in that machine at the Department of Motor Vehicles, they become familiar with it. But the key is the ability to use a mouse. If they have some computer experience and they can point and click a mouse, then they're able to do the ForeseeHome device. And the patients who are on the device really like it. They do it every morning as part of their morning routine, usually after their cup of coffee, and they don't miss it for a day because it gives them that assurance that someone's watching whether or not they're developing wet macular degeneration. So I have a 63-year-old woman who's a faculty member at the Washington University School of Medicine, and she read about the ForeseeHome device, and she came to see me because she was interested in detecting her disease early. She had watched her mother go blind in both eyes from wet macular degeneration. She knew she was at high risk because she has intermediate drusen in each eye. So she came to see me, we discussed the pros and cons of the ForeseeHome device, and she got set up with it very, very quickly. Within 3 or 4 months, she had her first alert in one eye. And at the time, her vision was still good at about 20/25, and we began initiating a series of 3 monthly anti-VEGF injections. And that was more than a year ago, and that eye is still 20/25 and has received in total about 5 injections. About 3 or 4 months after starting shots on the first eye, we got an alert on her second eye. And again, she got the 3 monthly injections at a very early stage when her vision was still 20/25. She's doing great. Her vision is excellent at 20/25, and she hasn't needed a shot in either eye in over a year. But I'll have to tell you that she didn't catch the wet macular degeneration on her own. The ForeseeHome device did. I see patients with intermediate age-related macular degeneration on a daily basis, and for some of them, they undergo genetic testing. And if the genetic testing comes back at very high risk within the next 2 or 5 years, I offer them the ability to have home monitoring with the ForeseeHome device. Now, I personally, as the doctor, don't show them the ForeseeHome device. I've appointed a very skilled person in my clinic whose responsibility is to train patients on how to use this device at home, and I found this program to be very successful.